Hello and welcome to LSND Live Community Conversations. I'm joined by Jennifer, Executive Director of FirstLink, and thanks for talking with us today. Um,
Well,
s-
and thank you, Marissa.
Please tell us about FirstLink services and what geographic area you serve.
Wonderful question to start us out off. Thank you so much. So, FirstLink is a nonprofit agency. We're located in Fargo, North Dakota, but our service area is the entire state of North Dakota and then 17 counties kind of up and down the Red River Valley. What we do is a lot of phone support. So, we answer both the 988 Suicide and Crisis Lifeline and also the 211 Information and Referral Helpline. And then from those programs, we have other programs that make sense to go with working with suicide intervention, such as community trainings, a community directory, care and support program for follow-up. So kind of a lot of different things related to suicide prevention and crisis management.
That's awesome. So let's talk about each of those programs that you mentioned. So you have a 211 call line and a 988 call line. So what services can be reached at each number?
Okay, so nationally, each 988 and 211 have like national accreditation bodies over top of them. But in North Dakota, they're pretty much the same because we cross-train. So our same staff are answering both phone lines. But generally, 211 information and referral helpline, people dial 211, so simple to dial just those three numbers, or you can text your zip code to 898-211 if you prefer to text instead of call. But typically, people reach out to 211 for financial help. So they might need help with paying their rent, help finding food pantries right in their area, help being linked to mental health providers in their system. So we keep a community directory of resources. In North Dakota and Minnesota, we have fabulous nonprofits that do wonderful work throughout our state. And we just want to make sure that we put all of that information all together. So we put that in our community directory. If you go to myfirstlink.org, it's all right on our website too. We don't want to keep that information to ourselves. We want everybody to be able to go to that information and find it. And then for 988 Suicide and Crisis Lifeline, people again call us for all different reasons. And on that phone line, you can call or you can chat or you can text. We want to make sure that people can communicate with us in the way that they feel that's best for them and most appropriate for them. But people are calling because of big emotions like thoughts of suicide, but it can be stress, depression. Maybe somebody has some anxiety because they have a big college exam tomorrow. Those are all fabulous reasons to dial 988.
That's so cool. So 211 and 988 are typically used by people in crisis situations, but you also mentioned that you have a care and support program. So who does that serve and what does that program look like?
Okay, so our care and support program is when it, okay, so 10 years ago when I first started, if somebody called in with a crisis, we would talk to them and then we would kind of just end that conversation. But we want to make sure that we are following up with people in times of vulnerability or in times when they need us the most. So our care and support program is us reaching out and calling them. So we do both internal referrals. So somebody can call us on 211 or 988 if they're having a bad day. Our call specialist might say something like, "Can we call you tomorrow and check up on you?" And we will call them the next day. And then we call about weekly for about 3 months. In that time of calling, we're screening for thoughts of suicide, emotional, social determinants of health. We're linking people to resources and making sure that they're okay. We also send caring cards in the mail and friendly texts and chats out if they care for that. We also get referrals from healthcare centers throughout North Dakota. So, like Prairie St. John's, All True in Grand Forks, um, Sanford, and many, many more hospitals. When somebody's discharging their facilities after us, like a behavioral health challenge, they make a referral right to FirstLink. And then we call and check up on people. We just want to make people feel like they're supported in our community, that they don't have to go at this alone, that they'll have somebody calling and checking in with them.
That's so awesome. I like that long-term support. So it's not just in the crisis situation, you're trying to help alleviate future crises that might occur.
Yeah.
So you mentioned that you have a resource directory and 211 can kind of link people to that directory. But how do you determine which resources are most important to include on that list?
That is a great question because when people call, there is a lot of need when they're calling. They might need some just some listening and support because they're just going through a lot right now and they just need to talk about their story. But during their story, we might hear that they are having trouble like paying their rent and they have soon to have an eviction notice. And of course, that brings a lot of stress and pain, and we're not sure what to do. So with a call like that, we first find out where they're located because our service area is so big, we have to know what city they're in. And then we use our community directory to search a referral. We can screen for eligibility to make sure that they qualify. Um, Nonprofits have different requirements for their helping based on like the financial help that they're getting with their grants. So we make sure that their age makes it. You know, some financial help needs different areas, and then we want to link them to those areas. And it could even be linking to Lutheran to legal services in North Dakota, especially with things with rent, because there's a lot of different rights that tenants don't realize that they have, and we want to make sure that they have help paying their rent, but also that their rights are being followed and that they're getting all the help that they need.
That's so cool. And so then do you update the directory often to ensure that those resources that are listed are still available, or how does that process work?
We do. So we have actually a national accreditation that tells us how to update the 211 directories throughout the United States. So it's a very robust updating process through Inform USA. And we just went through our accreditation process. And all of you out there that ever went through accreditation process, you know it's a lot of work for the entire team. So when we get the finalized email that we passed our accreditation, we're always very excited. But for our community directory, our accreditation says that we have to update our resources at least annually. And so we're calling or emailing or we do automatic updates. We kind of use the agency and what they prefer and how they prefer to update. Now, that being said, we also update earlier if we have that change. When we're out training or our partners in the community get to know us. So when they have changes in like the time that they're open, the eligibility requirements, maybe they move or even a name change of their agency, they often call us earlier than the year to make sure that we're updated so we can give the correct referrals out. It's so important because if somebody needs a food pantry, we want to make sure that they don't drive across town and maybe use the little bit of gas that they have left in their car to get there and they need it like a birth certificate to get that food or something in the eligibility and they don't have it with, and now they can't get their food. So we just really want to make sure that we give appropriate referrals when we're talking to people on the phone.
That's so great. And sometimes that going from one resource to the next without having someone connecting you to them can make that process feel really difficult and defeating for somebody that might have multiple needs. So it's great that you can kind of help streamline that process.
That's right, Marissa. Thank you.
So FirstLink also hosts trainings and has a library of printable resources on its website. What kinds of information do the trainings and resources cover?
So, a variety of training and resources, most of the time related to behavioral health and different things that we can do to help each other, even as community members. Right now, we have a fabulous grant through the North Dakota Department of Health and Human Services to do a couple of trainings. One is Safe Talk, which is about a 3.5 hour suicide intervention training. So the safe and safe talk means suicide alertness for everyone. And it's truly set up for professionals that have worked in the field of suicide forever can learn something to a community member that has never been, their life has not been touched by suicide and they can learn something. And so we're doing a lot of safe talk trainings. And then we also have been doing a lot of assist trainings. And assist is a really robust, a lot of information in that training. It's a full 2 day suicide intervention training. So kind of an intense class. People leave though and they're like, now I know what to do if somebody's thinking of suicide. When we don't have a grant to offer these trainings at no cost, sometimes we do charge for the training. So we just charge enough to cover our staff time and the material that we need for the training. So a few other ones that we've been doing is what happens when you dial 988? And when you work in an agency, you're just so close to that agency that, of course, I've been here for 10 years. I know what happens when you dial 988, but I'm finding community members, our therapists that are telling community members to call, they're not really sure what happens. So we do a 45-minute virtual what happens when you dial 988. And that's one of our biggest attendance trainings right now because people just want to know. And really, when you call 988, it's a simple process. So when you dial 988, you first get a national message that says something like you have reached the 988 Suicide and Crisis Lifeline. Push 1 to speak to the veterans line. And so those that served in the military can push 1 and their phone call automatically bounces to a specialized phone line. And then it says push 2 to for Spanish speaking. And so if they push 2, it gets bounced over to a Spanish speaking line. And then all others hold on. And then our FirstLink staff will answer and we'll just say, hi, my name is Jennifer. You reached the Suicide and Crisis Lifeline. Tell me what's going on. So it's just people talking to people on the phone line. Um, and so I just like to let people know that. And then also they can always test the line. So if you want to know, like, what does it sound like when I call? Go ahead and call 988 anytime with neighbors, family members, just for yourself and say, I'm just testing to see what happens when I call this line. And you can ask us any questions even before you need the service.
That's so great. I like that you have that test option so that people can kind of get familiar with it before the need arises, and then they might feel a little bit more comfortable engaging in that service when they do need it.
Yeah, yeah.
So do you have any other pieces of information about your services that you would like to share?
I think just that we don't want people to feel that they're alone. They can dial, text, chat 211 or 988 anytime. We never close. We're always here. When people call, they have just a lot of different things going on in their life. So we just want to be able to be that like sounding voice, that hope and help for the future. We just want to be able to link people to the resources they need. And so I always just pick up the phone and call 988. We appreciate that.
That's awesome. Now, you were talking about referring to other organizations and that you've referred to Legal Services of North Dakota before. What does that
Yeah.
referral process look like?
Okay, so we either can do different ways, depends on the person on the phone. So if somebody is calling and they need like an eviction notice is a good one. When somebody's in an eviction process, we do like to bring on legal services in North Dakota. There's a lot of other reasons too. People might be struggling with a marriage that's not working out and they need some advice with finances, child custody, divorce procedures. Legal services is a number we sometimes start people off with. But we can either say we have, um, here we have the phone information, and then we could either give them the phone number over the phone, or I can text or email the phone number to them with all the eligibility requirements, or I can live transfer the phone too. If somebody says like, "Can you just get me over there?" Well, then of course, um, Marissa, we're just gonna live transfer them right over to your office and do a live transfer. So I might say, "Hi, this is Jennifer. I'm talking to somebody on the phone and they need some legal help." Um, and then we'll just transfer that caller right over to you, to like your office or the other people, the other agencies in town.
That's awesome. That sounds like it kind of fits in with your idea of not having to send people to multiple different places without having that connection that can help them guide that referral. So that's so
Yes,
cool.
absolutely. Yeah. And a lot of times people are calling, they do might need multiple referrals. So like if a single mom calls and we hear a baby crying in the background and we can just say, it sounds like your life is really hard right now. There are some resources out there. So like in Fargo, there's places that we could refer to get free diapers and free formula. But then we would maybe want to look at long term too and just make sure are they on the WIC program, the SNAP program. So we want to do kind of immediate crisis supports, financial supports, and then like work towards longer term help too, like setting them up with the case manager in the community that can help maneuver some of this. Life can be hard and and we have a lot of places in North Dakota that can help us and we should use that help. That's why it's there.
That's awesome. Well, thank you so much for taking the time to talk with us today, and thank you for all the work that you do to provide support during times of personal crisis. To learn
Yeah.
more about FirstLink, visit myfirstlink.org. And to learn more about Legal Services of North Dakota and what services we can provide when a crisis creates a legal issue, visit lsnd.org.
Wonderful. Thank you, Marissa. Thanks for your
Thank
time
you.
today.